I would like now to invite to the podium Edward Brown from Ontario Telemedicine Network and Michael Green, President of Canada Health Infoway, and Tony, if you join them again. And I'm going to be sitting here with Hans-Jochen in Berlin. And please show us again the sun in Toronto. It's already dark in Berlin. It's going to keep us awake. All right. Thank you very much. Before we go back to you, Selina, and to Hans-Jochen, I would like to welcome our new members of the panel, Michael and Ed. And I would like to start with you, Michael, because your organization has been already mentioned. And also in my preparation, I found it very interesting what you do, because, of course, I'm only working on this topic since very recently, but I didn't find any sort of comparative organization here in Germany to such a scale. So if you could explain what you do, and before we go into more detail of your work. Thank you.
Yes, certainly happy to. So, Michael Green, CEO, President of Canada Health Infoway. And Selina talked a little bit about Infoway. We are an organization that was founded in 2001 by the then Liberal government. And we were set up as a not-for-profit kind of arm's-length agency, which gets its funding from the federal government. And all the provinces and territories are members of Infoway. And Selina mentioned that the government provides, or the federal government provides, a transfer payment to all the provinces for healthcare. But over and above that, the government also likes to fund specific programs. And so it uses independent arm's-length agencies, such as Infoway, to help the government look at trying to implement some strategies across Canada. For example, we specifically focus on the area of digital health. And so it's a way that the federal government can kind of help push and promote some Canada-wide initiatives. And so what do we do? So our mission is to promote the adoption of innovative digital health technology, and the goal is to improve health for Canadians. We've had $2.1 billion worth of funding so far, and of that we invest 75 cents in the dollar in specific projects. And those projects, we set the business criteria, the milestones and the goals, and we pay out on achievement of those. Our mandate has been to focus on, or the original mandate was to focus on the EHR. So when Infoway was founded in 2001, there wasn't an EHR. None of the provinces or territories had any kind of digital health or health IT policy groups. And so it was a kind of early day of setting up that vision. And what the focus was basically to make the EHR, electronic health record, available to all Canadians. Up until now, we feel that this is around about 93% available. And that includes drug information systems, diagnostic imaging, public health, telemedicine, and also hospital discharge reports. The focus of the last couple of years has been on physician EMRs, so in family primary care practices, and we've been kind of really focusing on programs to promote EMRs, and basically that program now, we've got about 75% of family physicians using EMRs. However, up to date, you know, the impact from a patient perspective has not been that visible, because a lot of these activities have been involved with getting the institutions and professionals connected. And so now our focus is more on looking at patient access and sustainability. And we have programs in place looking at personal health record, e-booking, e-referral across the system. I mentioned a couple of those programs we've been supporting, GCC, for example. And so that's our future going forward. And apart from the funding, we do a lot of other things to kind of really help with the change management and the implementation, because technology is just one issue. And that covers things like certifying solutions, change management, program management, helping to evaluate benefits of what technologies, the benefits they'll provide from a clinical, financial point of view. We do a lot of work in standards and interoperability, because it's obviously important. And then also in the areas like privacy and security, looking at those, trying to kind of coordinate a provincial and territorial response so that we have more common approach towards these policy areas. And then finally, really thought leadership in technology, best practice and policy. So that basically is a kind of brief overview of InfoWay.
Thank you. Just on logistics, could you pull the microphones a bit closer to you?
Oh, sorry.
So we hear you better. Thank you. And doing this work now since more than 12 years, what are the lessons learned? Also, if you think about that we are building up a similar system here now, which you could sort of recommend to Germany?
Yes, happy to. And there are some other similar organizations. I mean, one that is probably most famous is the ONC in the US, the Office of the National Coordinator, which has played a key role in the Meaningful Use program. And that office has really had the ability to kind of provide funding, on specific projects that related to digitizing patient records, and have been very much directed at physician incentives, as well as some disincentives for hospitals and physicians if they don't adopt the technology. But I think one of the key things is that when InfoWay was set up, it took a couple of years really for the organization to really get to grips with its strategy. And I believe that it's very important to have a solid strategy. And part of that is to make sure that you really also go out and speak to all the different stakeholders, and whether those are the provinces or their equivalents, the payers, the providers, but most importantly to involve the clinicians and patients and all the other professions that are involved in the process. Then I think it's very important to have a clear goal of what you really want to achieve and how you're going to achieve it, and then how that will be implemented. And once you've kind of come together with that, you need to kind of socialize that, get the agreement, really, and then work closely with the jurisdictions and the hospitals and regions to kind of implement the program. And of course, it's very important as well, because these programs need to be driven with resources, that you have the appropriate kind of financial resources in place. And, I think some lessons have been learned. Sylvia mentioned Selina mentioned the Panorama program, for example, in British Columbia, which was an early version of one of the programs we're involved in public health. And British Columbia was a province that took a leadership position, the first province to implement the public health system. And I think that, this was not an easy process, but from it, a lot of lessons were learned about how to scale very big projects, the importance of having the proper governance and project management in place. Having said that, I think BC, recently in response to the auditor's report said that, the system does work now, and so they are getting benefits from the system. But I think, we certainly have lessons to learn, and in terms of the usability of these solutions, because in the end, there's a lot of very good technology, but if the technology is not easy to use, if it doesn't provide a value, then to get physicians and people to adopt the technology is going to be very hard. So as well as funding, I think any organization like InfoWay has a big role to play in how one should effectively implement the technology. And then because we operate across a lot of jurisdictions, we're able to help best practice. So we run a lot of best practice seminars with various different groups, from clinicians to administrators to technologists, really helping them meet together and talk about how they've overcome certain obstacles and so on.
Thank you. When we get later to the general discussion, I want to come back to that topic of human factor. And also I would like you, Hans-Jochen, to reflect what has just been said on the German situation and where we are on the strategy to a more general e-health policy. But now I would like to turn over to Ed, CEO of Ontario Telemedicine Network. First of all, congratulations. I've read you won the Queen Elizabeth II Diamond Jubilee Award for what you do on e-health. You know, we consider the royal family in England always partly ours, so congratulations also from that side. What does she think of the topic?
What does the Queen think? Well, I was speaking to her yesterday, and I'm sure she's in favor.
Yeah, she's also meeting the demographic change age where it might take place. Let's go back to that, but please tell us a little bit, what does Ontario Telemedicine Network do? And perhaps you can reflect it with the general, what has just been described by Michael, to create more awareness and acceptance of e-health.
Sure. So thanks, Alex. Hello, everybody. By the way, thank you, Professor Bronze, for that great overview. I think a lot of the issues that we've been facing in Ontario and Canada are almost identical. Also, thank you, McCarthy Tétrault. Actually, I'm a physician, and McCarthy Tétrault actually defends doctors when they have lawsuits. So they're actually the only lawyers that we actually like. Okay. And of course, Michael's one of our big funders, so I got to thank you for everybody here. That's it. Perfect. Okay. You know, Ontario, just the context, we're here in Ontario, you know, very, very similar policy environment to British Columbia. They have better skiing. Otherwise, the health systems are pretty close. And OTN is actually, or OTN is Ontario Telemedicine Network. We're actually a not-for-profit, independent corporation in Ontario. But we are the agent of our provincial government to deliver telemedicine and virtual healthcare in Ontario. So our job is to make it happen, is to look for things that have value, that support the healthcare system, and figure out a way to get those things adopted across the healthcare system. So we were formed in 2006. We were the merger of 3 independent regional networks that came into one organization. We've been working hard ever since then. My definition of telemedicine is kind of the same as virtual healthcare. Which really is about, you know, how do we improve access to care using information and communication technology? How do we enhance the efficiency of health providers? How do we enable them to collaborate with each other, with their patients, with caregivers? And the new piece of virtual healthcare, which is really about people in their homes and how we engage people, support them, monitor them when we have to, but really help them to live a better life in place at home. So using technology for all of those applications is our mandate. So at OTN, there's really 3 things that we do. We provide some telemedicine services. We do a lot of promotion of adoption and change management, as you've heard, both for providers and for organizations and for regions. We look for valuable innovation that's out there in virtual healthcare and look at how we can work with the health sector to actually make it happen. So if I come back to those 3 things, just to give you an idea of the service mix, we've been doing rural video conferencing for a very long time. Actually, the history in Ontario goes back to the mid-90s. And we think we have one of the largest collaborative networks of rural healthcare anywhere. Last year, there were about 480,000 clinical video conferencing consultations between specialists in urban centers and patients in rural centers, avoiding travel. If you look at the travel that was avoided last year, it's about 260 million kilometers of travel avoided, and that's enough to go to the moon and back 330 times. Okay, so it's an awful lot of distance. And in Northern Ontario, our health system actually subsidizes patients to travel there for healthcare. So we avoided over $60 million in travel costs last year. And since our base budget is about $22 million, we think we are a profit center for the taxpayers of Ontario. So that's our main application. Of course, we also do other things. We do e-consultation, which is provider-to-provider communication. So a primary care provider can ask a question electronically of a specialist and get an answer back. For example, if you had a rash and I was your primary care doc, I could take a picture of that, I could send that to a dermatologist, get an answer back electronically. And the brilliance there is really about cost and about timing. So instead of waiting weeks or sometimes months to see that dermatologist, the average time is now 2 days in terms of getting the consultation back. And we're really extending that into a province-wide program. And of course, the final frontier is the home. And we've been working quite hard with InfoWay actually as a partner and the provincial government in Ontario to find patients with congestive heart failure, chronic lung disease, and to give them technology in their home to monitor their health, match that with a nurse coach who supports the patient. And that program has had really dramatic results. So we've actually reduced hospitalization by about 60% for those patients, reduced emergency department visits by about the same amount. Very dramatic results in terms of improving their health and outcomes. We're putting all of this stuff together. You know, technology is moving very quickly. So we put all this stuff together in one place. We call it the hub, and it's really the provider portal to all of these services. So providers can use single sign-on to get in there. They can do their video conferencing. They can schedule. They can send an invite to a patient, so they can actually video conference with a patient in their home from the hub and do all their other telemedicine work within that one place. And of course, we've moved from private network and hardware-based video conferencing to very much software-based video conferencing using the internet, making it faster, better, and cheaper over time. So that's the service area. On the adoption side, we have a team of folks. They're almost like sales folks who are out there around the province working directly with providers and organizations. We also have a consulting team that works with academic health facilities and other major organizations to build telemedicine into their actual business plans. So we want to banish the technology plan. We want to make technology a business process support for their core vision, their core goals for their strat plan. And that's really an important part of taking telemedicine out of the basement and making it just a part of everyday healthcare delivery. And finally, the most exciting application for us, number 3, is really the patient, engaging the patient. And we're looking at ways right now to take applications, things like automated coaching for diabetes, mental health, social networking sites, management for people in the home for chronic kidney disease. And we're looking at ways to do rapid evaluation of those and to be able to procure those on behalf of the healthcare system to make them available should they be successful. So we'll evaluate them, we'll pilot them, and if they're successful, we're going to look at how we can scale the important and valuable applications through the healthcare system. Just to make it simple for you, I realized the other day that we actually have something in common with Uber. I'm sorry, my last sentence. I got the time clock here. Because Uber is the largest taxi company in the world that doesn't own a taxi. Airbnb is the largest vacation rental place, and they don't own any vacation properties. And that's kind of what we do. We think we're one of the largest telemedicine facilitators in the world. We actually deliver zero healthcare services. We support the providers. We matchmake them with the folks who want their services. We support them with different technologies, but we actually deliver nothing in terms of actual healthcare delivery. I'll stop there.
Thank you. I'm going to come back especially to your last point, comparing your organization to Uber and other of these Silicon Valley originally driven new companies, just to understand, like you have the Ontario network, a telemedicine network, you have one in every province in Canada, and how do you sort of guarantee that you're not building up different technical standards in each province?
Sure. So there is telemedicine in every province, but as you've seen from Selena's presentation, every province runs its own healthcare system. So I would say every province has a different approach. Some of them have no centralized approach to it, and others have program leads within their ministries of health. I think Ontario is unique in having an independent organization that's an agent of government doing the work. We do collaborate, though. So at least for things like video conferencing standards, we regularly connect with pretty much every province on a regular basis. I think as we go into the bold new frontier of new technologies, that may become more of an issue, but because telemedicine is still such a green field, we essentially are calling out the standards as we develop these new applications.
Thank you. Okay, I'm gonna ask Hans-Jochen now about the German situation after we learned so much now about Canada before going back to Selina and then opening the general panel. Hans-Jochen, we learned now a lot. The provinces, obviously in Canada, have a lot to say in health policy, and everything I could read now about how we build up telemedicine networks in Germany, I don't see a general sort of federal approach, and I didn't see a real sort of a province taking charge or being leader. Like, I'm Bavarian. Normally, I was quite disappointed that Bavaria wasn't leading in telemedicine or anything concerning IT. Normally we are. So why is that? Is it because of our insurance and all these different players that nobody can really sort of make charge of and make a plan and get it done?
Well, there's different points to it. First of all, Germans tend to be perfect. If they do something, they want to do it perfectly. And to do something perfectly needs more time than just introducing something by trial and error. But to be serious, in Germany is not in the area of healthcare, not structured only as a federal state with federal government and regional government, but self-administration is a very important part of it. A lot of competences have been delegated from the federal government or the regional government to self-governing bodies of the medical profession. For example, professional law for medical doctors is not discussed and decided by the federal government, by the German parliament, but by the Federal Chamber of Medical Doctors. Or, as I mentioned, remuneration for any ambulant medical service, not only the telemedicine, is discussed and decided by the so-called Bewertungsausschuss, composed of representatives of the mandatory health insurance organizations and the medical doctors. And to give you an example of power of this self-administrative bodies, the German parliament in 2010 passed a law urging or forcing the Bewertungsausschuss responsible for defining medical services and remuneration to decide on telemedical services up until the 31st of March 2013. If I'm correct, that's more than 2 years ago, and nothing happened. They, in a certain way, the Bewertungsausschuss didn't care. And what we also lack, and this would be a task of the federal government, is a national strategy. Politically, government and the political parties in the federal parliament are in favor of telemedicine and are pushing for telemedicine. For example, I mentioned this law in 2010. Within the next weeks, the e-health law, representing also the will of the government and the parliament to improve and to force medical bodies to implement telemedicine, will be passed. But if we don't convince the medical profession because of its autonomy, we will not get anywhere with telemedicine.
Thank you. And going back to Toronto, by the way, very sorry that we always talk to your bags. Selina, we talked about that it's a lot of regulation, but to me it also seems as if regulation which has to be changed, but it's also mainly a change of mindsets. And I wanted to ask you, apart from the technical work, what did you make to get a change of mindset in British Columbia?
Thanks for the question, Alex. Yeah, I mean, I think definitely sort of beyond the regulatory change. I mean, the system, in order, I think, to achieve that kind of system-wide change really requires an overhaul in thinking and a new kind of approach to things. So I think it's really talking to the people on the ground. It's really about knowing the history of the organization and will help you sort of avoid any potential difficulties as they come up, and also increase the buy-in, because it's the actual people on the ground in the system who are users of the system, whether it's physicians, patients, or the healthcare providers, administrators. You need to get their buy-in to it's one thing to provide a usable system, but then you actually have to get them to use it. So I think engaging sort of physicians in the process, engaging patients and their families for that whole idea of, you know, we're moving towards a more patient-centered system that kind of Ed talked about in terms of focusing and engaging them. But strong leadership also. These kinds of things you need sort of visionary thinkers, and I think there are probably people in the system who do have that vision, who are thinking sort of big picture, long term, who have passion, there's a mission, who have an organizational strategy in mind, as well as, you know, they seek continuous feedback, because these are ongoing changes that are needed. You have to constantly, I think, reflect, measure, report on what you're seeing, and that's kind of a fair, objective way of looking at what you've achieved in the process, as well as standards. I mean, just to build on Ed's point earlier, yes, so each province administers its own healthcare system, and so that does, so it's not only in healthcare, but other also areas, sort of for environmental laws. Each province will have different kinds of environmental laws. So if you're operating across jurisdictions, that, you know, can be a challenge to kind of, there's not necessarily much harmonization. But I do think that there's an effort to share lessons and best practices. Every once in a while, the premiers, so the leaders of all the provinces and territories, get together to talk about issues. And e-health is, or healthcare generally, is quite an important topic. And they do have, you know, statements and papers and things to kind of say we should work together more closely. You know, I think no need to kind of reinvent the wheel where a province or another jurisdiction is doing something well, that we can learn from those. And so I think those are kinds of important leadership initiatives. You know, and also having standards is important, as Michael mentioned, implementing standardized documentation procedures, and those will be sort of transferable between systems, and that will ease the administration. So yeah, apart from the regulatory context, I think all of those factors are quite important. So a quite massive undertaking. It always amazes me how much, you know, the great efforts of InfoWay, health networks.
Before I turn to the audience to allow for questions, Michael, like, your organization is really pushing for information and for this change of mindsets. But if you work now, you mentioned you work on a new strategic plan. Like, according, who will be your first target? Is it changing the mindsets of the people, of the medical staff, of all these intermediary organizations involved in the health system? I mean, there's so many players. Where do you start?
Yeah, I think that's always going to be a difficult choice. What we're trying to do in our new strategy is to really look at areas that are going to impact on the patient experience. And, you know, I think that a lot of people always say they want to be patient-centric. And but the key thing is, how can you really make that happen? And so what we're trying to do, as I mentioned earlier, that we put a lot of investment in putting in the building blocks, but the kind of result of those are not necessarily evident yet to all of the Canadians who are using the system. And so we have done a lot of work kind of doing some, you know, certainly surveying the population, patients, consumers, and so on. And our focus is really going to be looking at specific areas that will make that journey better. And as an example, at the same time, sustainable, because earlier presentation mentioned that in Canada we spend over 11% of GDP on health, and so we're spending more than the average, but the results are not as good as the average. And so there isn't an appetite to spend more money, but there is an appetite to bring care, for example, into lower cost settings like care in the home. And so what we're trying to do is look at some of those key areas together with partners such as OTN, where we can run pilot programs and then scale those out, and in specific areas like diabetes, congestive heart failure, and so on, where we can try and treat patients more effectively in their own environments. And so it's a constant area or battle where you've got to really focus on what you want to achieve. And I think there's a number of different actions that have to be taken with all the various levels of stakeholders in this process. I think what we're trying to do is make sure that what we're doing is more kind of action orientated, and hopefully we'll come up with a good strategy so that we can help proliferate personal health records. And also we talked about, for example, in British Columbia, patients now have access to their lab test results, and this is something we're trying to extend. It's just started in Ontario, and that's an example of giving people the ability to take more control of their own health.
Thank you. I have a first question here in Berlin. If you could come to the stage, please.
Yeah, hello. Chris Begley from the embassy here. So first of all, I'd like to say thank you again. We're very happy. Es freut uns sehr, Ihnen zu willkommen hier in der Botschaft. So my question is, we've had two panels now. The first one was on entrepreneurship and startups. The second one on regulatory. How are you on the regulatory side working to bring in entrepreneurs, startups, this culture that's pushing for change? Because we hear a lot about strategy and plans, but nothing about companies or entrepreneur spirit.
Thank you. Whoever would like to answer first.
Okay, I'll start because we're actually working quite aggressively in that area. So one of the big shifts for OTN as an organization is that we had to provide services. So one time we thought Cisco told us we had the largest IP video conferencing network in the world. That doesn't seem so important anymore because there's other small networks like Skype and FaceTime and things like that you've heard of that do that now. And so we actually want to mainly get out of the service provision industry and leverage the new technologies, be it, we call it being a steward, finding technologies that don't necessarily, aren't the flashiest technologies, but the ones that have real results that the health system can use to change patient outcomes, to create patient-centered care that providers are willing to use. So we are setting up a structure to try to find those, to try to test those quickly, and then if they work, to scale them. If they don't work, throw them away as fast as we can. If they do work, look at ways to scale them. And that requires a whole bunch of steps. So we're building the evaluation framework to do that. We're building the partnerships to do that. And the last piece is really, how do we procure them? That's a big problem in the public sector. As a not-for-profit, though, we can procure things that other public sector organizations can leverage without having to do it again. So we're looking at really creative ways to actually procure technologies and make them available across the healthcare system. And we think through that, there'll be well-established solutions and also a lot of relatively new startups that can enter the fray as well.
Thank you. And I mean, there's a lot of... Oh, sorry.
Yeah,
Go ahead.
Michael Green. So I was going to say that, we recognize as well that there's a lot of economic benefits that come from the funding and the investments we make. And the 2.1 billion, a lot of that money has gone to the industry, so the industrial sector. We also recognize that some of the new technologies, when you're talking about consumer-type technologies, the way that we procure, as Ed mentioned, the way that the governments are set up is more for delivering institutional solutions. And so we're trying to help foster that innovation by work. Every province has their own kind of incubators, startup groups. Mars is one that Zaina Kayat was on from Ontario. So we're trying to work together with the provinces, also with those groups and other agencies, to try and encourage that development to go through. We also reserve a certain amount of our funding we put into challenges and kind of competitions, and so that we basically put out challenges where entrepreneurs and providers can come up with innovative programs and compete for funding to pilot those programs in the field, and we try and support those pilot programs.
And I mean, in the US, Mark Andreessen, the author of Software is Eating the World and one of the world's biggest venture capitalists, I mean, he just invested 200 million in software companies working in biology and healthcare. And how you're so much closer to the US, also in the way you do business, like how will the Silicon Valley approach to innovation get part of your e-health strategies and work, and also the same here for Germany in a second bit?
Yeah, I mean, I can answer first. You know, I think one of the things is that we're on the doorstep of the US, but also the US market is 10 times bigger than the Canadian one. And so that presents some advantages to Canadian players because they have a very close export market for their systems. Canada tends to be a more conservative environment in terms of investing than the US. We don't have the infrastructure of kind of venture capital going into this area at the moment. But there are a lot of efforts to try and stimulate that development, and certainly we're trying to encourage that as well. I think we're still in the early days, but we need to create a more conducive environment for risk-taking and also make it easier for small companies to deal with a very complex public sector health system.
Yep, I agree. Also, I think our problem actually is not invention. Our problem is actually innovation. So I think Zaina said it pretty well this morning. We have a ton of technology available right now that we're not really leveraging across the healthcare system. So new things are always welcome, but I think our biggest challenge is innovation, which is really about a new business process that scales. So how do we use the technology that we know is pretty good and actually have it make a difference in the way we deliver healthcare and really get that disruption, those benefits that we're looking for? And I think that's a bigger challenge than new technology right now.
Thank you. Tony, do you see any questions from the audience in Toronto?
Yes, I see a question from Dr. Matthias Mück. Go ahead, please.
Yeah, I would have a question which is relating to a couple of things that have been mentioned during the discussion. I understand from... Is that better now? Yeah. Okay. Yes. I understand that on a provincial level or in Canada, you have different health systems and also different telemedicine systems on provincial levels. There is definitely a challenge to actually treat patients across provincial borders. Can you actually do this as OTN, that you treat patients outside of Ontario, technically? And also, are there some regulatory restrictions or things that you need to consider when you're treating a patient, for example, in British Columbia?
Yeah, technically there isn't a problem. So the primary mode of telemedicine traditionally has been video conferencing. The standards are there. We can connect pretty much with anybody through various gateways, IP gateways, even dial-up gateways if we have to. So the technology's there. And it does happen every day. For example, you know, just down the road here, University Health Network has one of the only lung transplant centers in the country. Their patients come from all over the country. They see them regularly and follow up so the patients don't have to fly back. Different provinces do have different regulations. I can't remember them all, but I can tell you the doctors mostly, you know, kind of have a little process, or sometimes, you know, they ignore them because it's really about the patient care and it's not a big deal. But each province does have a bit of a different regulation set. It's a much huger problem in the US because you do need to have a license in pretty much every state when you practice, and a lot of those states are pretty close together. There's one company down in the US that says they employ almost over 200 people who just maintain the licenses of all their physicians who have to do cross-border care all the time. So it is a lot easier here in Canada to do that.
Thank you.
Now I would like to ask a follow-on question. Are you the exclusive provider of a telemedicine network in Ontario, in the sense that if a hospital or healthcare center would like to provide telemedicine services, that they have to go through you because you offer like secure lines, so or these kind of
no, we're not.
Things?
I mean, you can do whatever you want. There's no laws, and there's stuff we certainly don't provide. The one thing, though, is that if physicians want to bill their health insurance system for the work that they do in telemedicine, then they do have to use an OTN certified technology.
We have a question here in Berlin. Bitte kommen Sie her. And if you say who you are.
Hello, greetings from Berlin. So I'm Nana Bita Regim, Stiftung Charité Berlin. My question is just from the prospect of patients. Knowing that, several geographical challenges in Canada, a big country with I just checked it, I just Googled 35 million population. Do you think is it any need to provide coast-to-coast electronic health care record system, which will just cover the whole country, and that would be probably a specific help and to transform I'm talking about the transformation of delivering healthcare system. The same question would be to my German colleagues. So we have a long-term traditions of telemedicine. So whether it is November 20th, 2015 is a particular time point where we can just talk about, not just talk about, but probably implement this opportunity to provide all patients with the electronic healthcare records. Thank you.
Thank you. Hans-Jochen, would you like to start?
Yes. First of all, as far as I can see, in Germany, patients don't object to telemedical applications. On the other side, they have little influence on developments in the healthcare system because in Germany patients are not well organized, and in some of the patient issues are taken up by the consumer protection organizations, and there are some specialized patients organizations like patients with diabetes are organized in a diabetes organization, and they are rather influential, but only in their own area. I think if we would have powerful patient organizations in Germany, we would have more innovations, not only telemedical innovations, but other innovations as well. And that's a problem we have. One general remark, probably I've sounded rather pessimistic with what I have described about the German situation. But personally, I'm very optimistic. I think because of the long-term trends which I've mentioned, we will have major breakthroughs in the area of telemedicine in the next 5 years. If you would have asked me, let's say 3 or 4 years ago, I would have told you, ask me in 15, 20 years, if I'm still alive at that time. But the process is progressing and picking up speed in Germany. And especially because of the demographic situation, we have to overcome problems in our healthcare system. And as I mentioned, all across the political parties, there is no difference between CDU, SPD, Grüne, Linke. All parties and the government are pushing for innovations in healthcare, especially in the direction of telemedicine.
Yeah, thank you. Actually, the German Minister of Health, he's quite drastic about it. I mean, it's really sort of, he's warning all organizations hindering further progress by saying, we're going to just cut your budgets if you don't get on the train right now.
Yeah, yeah.
And he's just sort of speaks publicly out like that, and I found that very interesting. But giving the question on to our panel in Toronto, who would like to take it?
Yes, I'd just say a couple of words. The original goal for Infoway was to have a pan-Canadian health record so that someone in the East could travel to the West and their health record would travel with them. But I think in the end it became apparent that first, before you do that, you want to be able to do it within your own location. And so basically the focus has been mainly on the provinces and territories, making sure they can actually do that within Ontario, that you have that interoperability. And we're getting to the stage where now I think that does exist. And then also, let's face it, 99% of healthcare is done in your own region. So the key benefits are going to be get from regional cooperation with different healthcare providers. However, in the end, I think organizations such as Infoway, what we can try and do is make sure that when we're involved in our investments and also in the areas that we're involved in terms of thought leadership and different kind of groups, that we try and make sure the standards are kind of used in a consistent way so it will be and is possible for kind of cross-country coordination.
Thank you.
And just to build on that, yeah, just outside of actual, the implementation of systems within your region and province, politically, it's very difficult in Canada because the provinces and the federal government often, especially where there's shared jurisdiction, it's a bit of a push and pull about who's control what. And the provinces like to be in control of their healthcare budgets, of their processes. Each provincial government will have slightly different priorities. And so they don't like to be told what to do. And in other areas of law, such as securities law or environmental regulations or things like that, it's very difficult to have just a national, provinces can coordinate and work towards a common goal, but they're going to do it in their own way. And each region will be different. Each region has a different population makeup and demographics and pressures. Newfoundland and Labrador will have different, demographic situation than in Alberta or in Saskatchewan. So I think just apart from the actual technically made possible and maybe you can get buy-in for harmonized sort of systems, but at the end of the day, politically, the provinces will be very loath to give up any kind of jurisdiction.
Yeah, I guess, who doesn't love a national vision? Canada was built by the railway from coast to coast. Otherwise British Columbia would be part of Russia today, probably. So it is important, but as both folks said here, healthcare is very local. There's no brand like BMW or SAP that does healthcare. But I think the twist on that is that healthcare is becoming more and more retail oriented. We're seeing that, there was a study recently that of the Fortune 50 companies, something like almost half of them have healthcare strategies. And these are folks who aren't normally in healthcare, like the JP Morgans of the world, or even Ford building, healthcare apps for their cars. So as that retail piece starts to spread out, I think we will start to see national brands, but I don't think it'll be driven by us folks who are in the public sector type space. I think it'll be driven by the private sector and their retail brands that are already existing.
Yeah, in the preparation, I always had also thinking of our last year topic of startups. I also had the impression that the whole startup sector is giving such a pressure on the health market now because they come up all the time with new ideas and techniques, and by patient groups they are used like for diabetes and so on. And I must tell you this because our German Minister for Health, he said, we have the Porsche in the garage concerning techniques, and now I want everybody to get on the Autobahn. So I was wondering all the time, do you already have our Autobahn concerning health in Canada? would you say you're really like building the right route so that all the new techniques can jump on? No?
Maybe we made it sound too rosy here.
I think we still have work to
Because,
do.
yeah, I mean, the problem we have is our healthcare system is perfectly structured for the 20th century. You heard that from Zaina this morning, the fact that we, have a great acute care system, but we haven't really organized ourselves to really bring care where it's needed most to the home. And that's the next change we have to do, and that's where, as you heard this morning, 80% of our healthcare costs are at the moment. So I think we have structural changes to make, we have transformation to make. I think the really exciting thing, though, is that these technologies are going to be the engines that are going to support that transformation, and we need to marry the technology know-how with the political will to make the sort of changes we need to get that Autobahn happening in Canada.
Hans-Jochen wanted to add something to that.
Picking up the image of Autobahn in Germany, in the area of healthcare, I think we need at least 2 additional decisions. First of all, in order to drive on an Autobahn, you need a driver's permit. And for example, at least in Germany, medical doctors, nurses don't hear anything about modern information technologies in medicine during their studies. And so in a certain way, it would help a lot to teach young or future doctors and nurses how to use modern information technologies to deliver innovative modern services. Second problem, in order to drive on an Autobahn, we have to do away with an interdiction to drive on an Autobahn, the Fernbehandlungsverbot, the interdiction to treat a patient remotely. I mentioned already during my presentation that this is not an absolute interdiction in Germany, but in political discussions, many medical doctors and their organizations think there is still an absolute interdiction. For example, very often they argue, I would like to use telemedicine, but I'm forbidden to do so. The Federal Chamber of Medical Doctors in Germany voted a change in the professional law in 2010, changing the absolute interdiction to a relative interdiction. As I mentioned, the doctor is forbidden to treat a patient exclusively at distance, meaning that he has to see him once in a while, personally. But in the political decisions, very often, representatives on medical professions, but also other organizations, are arguing with the interdiction to drive on the Autobahn as if it were an absolute interdiction.
Thank you. All right. I'm going to ask Tony if there are more questions in Toronto.
Yes, we have one more question.
All right. And then I'm going to wrap up.
Yeah, this is Matthias Mück again. I would like to comment the last statement from Professor Browns about the fact that you can't treat patients remotely. This reminded me of a discussion we had with the Kids Hospital in preparation for this conference, and they showed us their telemedicine infrastructure that they're using for decades now, and they also pointed out that they're using the service as an export article. So they are treating patients in the Middle East, if I remember correctly, out of Canada. So I'm just wondering if Germany is missing an opportunity to export their medical expertise in the sense outside of Germany by the fact that we have this law that is prohibiting doctors to treat patients over a longer distance.
I think, like smartphones or any other modern devices, telemedicine doesn't know any borders, and it's a contribution to internationalization. For example, a lot of patients are coming from Arab countries and from Russian-speaking countries to Germany because of the quality of the medical services and are paying a lot of money for it. It would be very helpful, for example, to have something like telemedical representative offices of German hospital, let's say in Dubai, Abu Dhabi, in Moscow, in St. Petersburg, where German medical doctors through telemedical devices could participate in the diagnosis of a patient. So if they come here, the German doctor has already precise diagnosis. Very often, patients are coming with diagnoses which are not correct. And all of a sudden, the treatment becomes much more expensive. And there's another personal human aspect. If you come here to Germany as a patient, let's say from Abu Dhabi, Dubai, from Moscow, you have your first personal contact with a medical doctor here. And if you don't like him, if you don't trust him, you have great difficulties to say, no, I don't want to be treated by you. I would rather prefer to return or look for another doctor, because you have paid, you have taken the decision without being able to build up a personal relation with the doctor. And these telemedical representative offices would allow a contact between the treating doctor and the patient while the patient is still at home. And there he can decide, I rather will not come to Berlin.
Thank you. I'm sure the hotel industry wouldn't like your idea so much. The hotel industry wouldn't like your idea so much because we, at least in Hamburg and Munich, it makes a lot of business. All right, I would like to close that session by a last question into the round. You're all working on the idea of making e-health and telemedicine work. So when will we have our system transformed that we don't have to discuss it anymore, but that it's taking place? So from each of your prediction, Hans-Jochen, when do you think? You said before 15 years, now it was already 3 years?
Well, if I understand correctly, I mentioned already, I think we'll have major breakthroughs within the next 3 to 5 years. And because, another brief remark before I come back to the question, I think we have to be aware that telemedicine is an issue of the medical profession, and it's not primarily a technological aspect. And in Germany, up till now, the discussion about telemedicine is technology-driven and not healthcare-driven. And we have to change that, and it's changing.
Thank you. Selina, when do you think what you work now as a strategy and implementation will be a regular system as such, with all the mindsets included?
Wow, that's a big question. I'd say probably significant progress, 10 years, I would say, optimistically.
Optimistic, but that's a good number. Michael, Ed, any predictions from your side?
I'd like to be more optimistic. And I think there'll be significant adoption in the next 5 years. And I think one of the driving factors is certainly the consumerization that Ed mentioned, that now we're beginning to get big companies involved, consumer companies involved. And once that happens, then I think that the pressure will increase as people these apps become more available and more accessible. So I think within the next 5 years, we won't be totally there, but I think we'll be in a very different space.
Thank you.
Yeah, humans to be linear thinkers, but I think we're actually sitting on an exponential growth curve now. We're at the bottom of the hockey stick, if you will, right now. And so I will predict that within 3 years, 50% of all healthcare transactions will be virtual.
All right.
We won't be calling it virtual healthcare anymore. It'll just be healthcare, because most of it will, in fact, be virtual.
Right. Thank you very much. And thank you very much to all the panelists, Hans-Jochen, Selina, Michael, Ed, Big applause to you. Thank you. Actually preparing this, I thought it's crazy. You can't talk about the political regulations in the health business as such in 45 minutes, but I think we made quite some progress here, and at least I learned a lot. I hope all of you did as well. And for my part, that would be already all for today. I really want to thank you all for being here and actively discussing with us, bearing with us for our technical tryouts in the beginning. But I suddenly feel that what I use at the moment for fun and work, like my iPad, my little smartphone and so on, just for fun and leisure and of course for work, someday will, or sooner, let's say between 5 or 10 years, will be the guardian of my health, and I definitely probably will stop smoking by then. All right. Before handing now over to Christina and Jurian for the conclusions of the day, just some logistics. Once we have closed it here, there will be lunch in Toronto and a reception here in Berlin. The Hertie Foundation here in Berlin is just a 10 minutes walk, and I'm sure there are some volunteers showing the way for those not knowing it. And I just want to thank everybody over there in Toronto. It was great to have you here on our screen and talking to you. And I want to thank all my guests, and I want to thank the organizers of this session. And handing now over to Christina and Jurian. And thank you, Tony, for being my good second voice over there in Toronto. Okay, thank you very much.
Well, I think we can all agree that we heard some very interesting talks and presentations today. Certainly for me, leading up to the conference, I've been reading a lot about e-health. I'm not from the e-health sector. I'm actually from the aerospace sector. Thinking about that, perhaps John Ross should have a talk with him, because I might have a new customer segment for him. If you think about the astronauts on board the International Space Station, that could be an interesting customer segment for you. And think how difficult it will be to do a medevac with the astronauts. So the question was, how e-healthy are Germany and Canada? And I think we got some answers today. There's many aspects to it. There's the political side, the governmental side. I see a lot of efforts there. The government is setting up frameworks where they define the infrastructure needed for e-health, so the physical infrastructure and connectivity. We see the governments trying to set up standards. Think about the electronic health record. It's important to have a common standard there. And the government is also defining legal standards. So think about privacy, data protection, but also think about cross-border telemedicine. So e-health for the government can be seen as a health promoter towards the public, and it can also be seen as a cost saver. I think I looked up some numbers, but I must have got them a little bit wrong. I think Selina said 12% in Germany, 12% of the public spending goes to, government spending goes to healthcare. I had it at 19, but I'm sure I'm wrong. It's the second biggest source of expenditure for the government. So that shows there's some saving to be done there. Then from the technological and economic point of view, I got the feeling that the commercial market is stepping in now and is starting to push developments. We had a very, very interesting trip to the Charité, where they showed us a project. It started with kidney disease patients, They set up this project together with SAP and an insurance company, AOK, and a lot more other companies that I actually forgot. It seems like a very comprehensive program where they're setting up an infrastructure for the patient to contribute his data, for all healthcare providers around the patient to enter their data into the system. And when I was listening to them doing their presentation, I was thinking, why not blow this up into and make this the model for Germany? It was a very nice presentation. Then we see apps and software being introduced every month, new apps, especially Ampera. I mean, today was a very nice presentation on their diabetes app, and yeah, we learned a lot there. There is a part of technology that we haven't talked too much about. I think it's portable medical devices or medical devices with connectivity. I got a personal favorite there. I was reading about a portable ultrasound device that you can connect into your tablet. Just think about the possibilities there. I mean, take this device to remote areas, or take this to places like Africa. I mean, just think about the potential there. And then we have a final category, remote patient monitoring, and we had a very nice presentation on that from John Ross. So coming to the last part, the social part, I mean, that's what e-health is all about, and healthcare is all about, the general public. And there I see a couple groups. I mean, there's the group of people that are deprived of healthcare. I mean, think about the possibilities of e-health there. And there's the people like in Germany and Canada. I mean, we're very privileged. We have the chance of receiving healthcare, but still, e-health promises you the possibility of getting involved, whether you're sick or not. I think the time is right. I mean, the other day I was reading a story in Die Welt, a Zeitung, newspaper, that apparently, on average, people are spending three hours a day using their smartphone. And with young people, that is once every 7 minutes they grab their smartphones. And just think about what are the I mean, if they would spend just a percentage of that, spending that on healthcare apps and on their own personal health. I mean, think about the changes there. But also think about yourself. I mean, how often do you grab your smartphone and compare that against how often you do a blood pressure check or a medical checkup? I think there's a lot of potential there. And once we realize it, it's going to take off, I think. Over to you.
Thank you, Julian. Yes, my name is Christina Arendt from the Canada Meets Germany Network Association. And on behalf of my fellow board members, Dr. Matthias Mück, who's in Toronto right now, and Gerd Hoher, I'd like to thank you all for coming. I'd like to thank Ambassador Gervais Vidriquet for having us here at the embassy, and Botschafter Pnent, thank you very much for your support in Toronto and Ottawa. Thank you to all our speakers and panelists for joining on this journey in e-health. And thank you to our co-organizers, actually. Julian de Bruyne, he's actually the core of the subject. He suggested the subject e-health for this year. So thank you, Julian. And thank you also to Hannes Weiland, who I did see, who I don't see right now. Oh, there he is. Thank you, Hannes. Actually, Hannes and Julian were participants of the GCC last year, and they jumped on the organization team and supported us for organizing or in organizing the GCC this year. So thank you, Julian. Thank you, Hannes. And last, but certainly not least, thank you, Alex, for moderating the GCC for the second time in a row. Thank you very much. You are not a newbie in e-health anymore, I can tell you. So thank you very much, Alex. Thank you, Tony, for supporting Alex in Toronto. Thank you.